Welcome everybody to our Timely Topics webinar featuring Dr. Mandy Cohen, who will update us on COVID-19 and the status of healthcare in North Carolina. I'm Diana Wynn, President of the League of Women Voters of Wake County. Before we begin, I have just a few announcements regarding some other league activities and events that may be of interest to some of our members. We have some members-only events coming up that may interest many of you. Our next Diversity, Equity, and Inclusion Roundtable discussion is on March 23rd, and it will explore the topic of defunding the police and what that might mean. This is a members only activity open to any league member in North Carolina. Our next League Lit event on March 5th will discuss the book Team of Five, which focuses on the relationship of past U.S. presidents. Our monthly League Lit sessions are open to any member of the Wake League, even if you haven't had a chance to finish reading the book. And we have a fun social event for LWV-Wake members involving a virtual treasure hunt that will be done via Zoom. This will be a fun opportunity to get to know some of your fellow League members here in Wake County. Our next Timely Topics webinar is March 18th, and it will address how to spot biased news coverage, deep fake images, and more. All of our Timely Topics webinars are open to the public, and you can find more information about all of our activities and events at lwvwake.org. If you're not already a member of the League, you can also join us online via our website. Before we begin, I want to briefly explain how we are using the Zoom platform for this webinar. Except for the presenters, everyone is muted and you're not on video. We're not using the chat feature in Zoom. Instead, please type your questions in the Q&A screen. If you hover your computer mouse near the center bottom of your Zoom screen, a menu should appear for most of you on your computers. You should then be able to click on the Q&A option. Our moderators will be monitoring the Q&A screen throughout the presentation. At the end of the presentation, the speaker will be asked your questions. We'll try to get to as many of your questions as we can, but please don't wait until the end of the presentation to submit your questions. Diane Payan, our Timely Topics Committee co-chair, will monitor the questions submitted and will serve as our moderator for the Q&A segment. This webinar is being recorded and in the next few days will appear on LWV-Wake's YouTube channel. I'd now like to turn the program over to our other Timely Topics Committee co-chair, Cheryl Keaton.
Good evening, I'm Cheryl Keaton, and I'm joined this evening by Diane Payan. We're the co-chairs of Timely Topics, and we want to express our thanks to the League of Women Voters Wake Healthcare Committee for sponsoring Dr. Mandy Cohen's presentation this evening. We'd like to invite you to join the Healthcare Committee. You can find out more about this committee and others on the LWV-Wake website. To introduce our speaker, I welcome Retta Riordan, Healthcare Committee Chair. Retta?
Thank you, Cheryl. We're so pleased to have Dr. Mandy Cohen join us today for this extremely timely topic. We had first invited her for last year's timely topic, but the pandemic overpowered us and we had to postpone till this year. In the meantime, Dr. Cohen has become the voice and the face of the pandemic in North Carolina, providing us with a steady hand and a level head in keeping us safe. I know I feel comfortable when I hear her discuss the science and the resulting recommendations and directives she gives us. First, a little bit of background on Dr. Cohen. Governor Cooper appointed her 4 years ago as Secretary of the North Carolina Department of Health and Human Services. It's a huge department. It consists of some 17,000 employees, and she has a budget of some $20 billion. Dr. Cohen is an internal medicine physician, and she came to us from the U.S. Centers for Medicare and Medicaid Services, or CMS, where she was the chief operating officer and chief of staff. And during that time, she was working on a number of very important policies for Medicare, Medicaid, and CHIP, which is the Children's Health Insurance Program, as well as what was called the Federal Health Insurance Marketplace, or Obamacare. She received her undergraduate degree from Cornell, her MD from Yale, and her MPH from Harvard. As to COVID, Dr. Cohen has initiated a multi-pronged approach, including looking at hospital surge capacity, testing capacity, tracing capacity, and PPE availability, as well as developing policy guidance to guide the actions needed to slow the COVID-19 spread here in North Carolina. But the department also oversees numerous other critical programs, including Early Childhood Action Plan, opioid crisis, including with an aim to reduce opioid overdose deaths by 20% over the next 4 years, access to high quality medical care, including ensuring equitable access to health resources, and enhancing North Carolina's Medicaid program. And this includes closing the Medicaid coverage gap, which is a subject that's near and dear to the hearts of those of us on the Healthcare Committee. And with that, Dr. Cohen, we are indeed honored to have you join us today, and I'm turning it over to you now. Thank you.
Well, good evening. First, thank you, Retta. Thank you, Cheryl. Thanks, Diana, and everyone for joining this evening. It's a beautiful evening, and I hate taking away your hour on a webinar on such a beautiful day, but thank you for spending some time with me today. I'm going to focus mostly on COVID, but then I'll end with a couple of key takeaways for the future. But I have to start by thanking the League of Women Voters. I spoke to the group a couple of years back now. My mother-in-law, who lives in Atlanta, Georgia, is very involved in the League of Women Voters. And I told her the other day that I had the opportunity to speak with you all again, and she was delighted, and then invited me quickly to join the one in Atlanta by Zoom as well, which I will do. So very close family association to the League of Women Voters, because she is very involved in just sort of similar work, Cheryl, to you and to Retta in the Atlanta area in Marietta. Anyway, so with that, I'm going to jump in and talk about COVID. I have some slides here for you, but just they're really more to help us guide the conversation, and then I'll leave plenty of time for questions. I'm sure there's a lot on your mind, a lot going on. So the first thing I wanted to update on is, where are we overall with this COVID pandemic? What do the trends look like? What does that mean for us? And this was a really good week to have this presentation, because the governor and I just, I'm losing track of days, just yesterday, made some announcements about where we are for this pandemic and what that meant in terms of the restrictions we've needed to put in place. So as you likely know, we've been up and down through this pandemic. And what we saw is a real big surge of cases and a real strain on our healthcare systems because of COVID during the holiday season. So the December and into January timeframe was very concerning to me. I was very, very concerned. We did a lot of hard work to protect folks, but there were times, particularly at the end of December, beginning of January, where our healthcare system was incredibly stretched. There were some hospitals out west. We needed to put up a field hospital. Many, many hospitals were not able to do their non-urgent procedures. They were only doing the things that were extremely urgent, just because they did not have enough beds and enough nurses and enough doctors, because they had so many COVID patients. But the good news is that following the holiday time, really from January 10th on, we sort of hit a peak, and we've been coming down since, which is good. So since January 10th, we have seen a decline in our cases, which is terrific. You can always follow along on our trends with us on our dashboard. We update it daily. And what you can see on this first slide here, these are the 4 key trends we look at to help us make decisions about where should we be in terms of easing restrictions. We look at what's called COVID-like illness. That's in the top left here. It's our earliest warning indicator. It's sort of surveillance data before we even get a test result back. You can see from that red line, it's heading down. You see in new cases, if you look at that yellow line, that's our 7-day average. You can also see since the beginning of January, that really high peak, we were peaking at almost 9,000 cases a day. we've come down. And so this week we're seeing closer to 2,000 to 3,000 cases a day. Still, 2,000 to 3,000 cases is still a lot of cases a day. We're sort of numb to the numbers. We're down about back where we were in the October timeframe. And then hospitalizations really coming down. We have peaked at nearly 4,000 people in the hospital in any one given day in North Carolina. That's quite a lot. Now we're down closer to 1,500. We never needed to send patients out of state. We never overwhelmed our ICUs. We never were out of ventilators. That is a terrific hard work that we did in North Carolina. And then our last metric is a percent of tests that are positive. It tells us, are we finding enough cases and what's the level of viral spread? And that as well has really come down nicely. We were in the double digits for quite some time, and we've come down now. And for the first time today are below 5%, which is really our goal. It's really great to see. And so because of our trends moving in the right direction, the governor and I made an announcement yesterday about easing of restrictions. And I want to say, to remind folks, is that we're in a different place for two reasons. One, our trends are moving in the right direction, but also, and I'm going to talk a lot about vaccines, we're in a different place because we have another tool to fight this virus, and that's vaccine. And I'm really excited about our progress on the vaccination front, and we'll get into that. So just to review what we announced this week, of going to the next slide here, we are easing restrictions. It's one of the biggest, steps forward we've taken. But I want to remind folks that there's a wild card here. And it's the variants of the COVID virus. You've probably heard about them, that the fact that this virus is changing. And that's what viruses do. It's the reason we get a flu shot year over year, because the flu virus changes every year. So it's not surprising this virus is changing, but we're trying to understand what that impact is. And what we have seen is some of these variants are even more contagious than COVID is. And I want to make sure we understand how contagious COVID is before I get into all of the easing of restrictions. COVID, as you know, we have been fighting during the winter season, which we usually see other viral illnesses. I was just mentioning flu, right? This is also tends to be our peak flu season. And if you look at our data, which we track very closely on flu is almost non-existent here in the state and in the country. It's because we're doing the 3 Ws. The 3 Ws work for COVID, they work for flu. And it just goes to show you how much more contagious COVID is than the flu, right? I just told you flu is basically non-existent because we're doing the 3 Ws, but we're still getting around 3,000 new cases of COVID a day. And the wild card that I just want everyone to remember is that we have these variants that are even more contagious. Now, they are not the dominant strain here. We are tracking them, but we've had about 1,000 cases, we believe, of that strain here. But as a proportion of the total cases, it's not dominant, so that's good. But it is a wild card here to understand what do we have to think about going forward. And that's why you're going to see a couple things from the governor. Now, we did lift the stay-at-home order, but we kept the mask mandate. We are going to be wearing masks for the time being because, again, vaccine's not widely available yet, and we really have to continue to protect each other as we go forward. But here's the good news: we did ease restrictions. We did decrease some of the restrictions and are allowing for 50% capacity in quite a number of settings. Our retail settings are restaurants, breweries, our gyms, museums, and other salons and other things. We had an alcohol sale curfew that was at 9 p.m. We moved that to 11. So we did make some adjustments. On the next slide here, there are some higher risk settings that we kept below 50%. We kept it to 30% capacity with a 250 person cap per room. Those are things like indoor bars. So we did reopen bars for the first time in a very long time here in North Carolina. But again, these are settings where you're indoors and you aren't wearing a mask continuously, right? You take your mask off to drink, and bars by their nature are gathering places, right? So we know from our research that viral spread in bars is much higher. Same thing for meetings, receptions, and conference spaces. The reason that we keep things at 30% for a meeting or a conference space is because when you go to a meeting and you see your friends and colleagues, you gather. which is different than when you go to a restaurant and there's a bunch of strangers eating in a restaurant together, right? There are different kinds of risks that we see in meeting reception kinds of places. So we do want to have a bit lower capacity for those higher risk things and cap them at 250 people in one room together. But then there are things like our sports fields or our movie theaters that can be at 30% capacity. If they're outdoors, 30% no cap, right? So there's no cap if you are outdoors, but for indoors, so if you are an indoor, say, high school gym, we do want you to be at 30% and capped at 250 people. You can still have 250 people. That's still a lot at a high school game. But if you are in an indoor venue that has more than 5,000 seats, the Dean Dome, right, then you can be beyond that 250, right? That's a very large venue. And so assuming you're taking some additional safety precautions, you can have up to 15% capacity, which gets people into the thousands in the same location. So we're really trying to, recognize that our trends are doing better. We know how this virus spreads. We know what works. Masks work, social distancing works, and washing your hands work. And so we're going to keep doing that. But I think this is a positive step forward. And part of the reason I feel really positive about where we are is because of our ability to get vaccines in arms quickly. I'm going to turn over to vaccines now, but I think the top line, as you hear everything about vaccines, is that the supply continues to be very limited. And that is the driving story here on vaccines. We are getting vaccines into arms really quickly. We get vaccines here, the first doses are out into arms within days. And so I'm really excited both about that and the fact that we're going quick, but also we're going in an equitable way and making sure that we are serving all the communities of North Carolina. But we know this has been complex and it's really hard when you have a low supply. You have to move through this in stages. And that's exactly why we have a prioritization. So I want to walk through that in a little more detail here. So it's on this slide. It starts with the purple, where we started with healthcare workers, long-term care staff, and residents. So the way we thought about this prioritization overall was to want to vaccinate those who are at the highest risk of severe disease or death. And those are the highest risk of exposure to the virus. So it's pretty obvious that healthcare workers who were working directly with COVID patients, the ones who are wearing N95s every single day to work, those are the folks we really wanted to get vaccinated first. And then second, we wanted to make sure we were vaccinating the medically frail, those in our long-term care settings, our nursing homes and other long-term care settings, as well as the staff that takes care of them, because we were seeing, it's been very challenging in these congregate settings to control viral spread. So that was number one. And again, all of these categories align with the federal guidance. We've called them something different. We do 1, 2, 3, 4, 5. The federal government does 1A, 1B, 1C, 2, right? We just kind of made it easy and we said, let's go to 5. Yeah, 1, 2, 3, 4, 5. So after healthcare workers, then we've been doing what we have been for the last number of weeks since the middle of January, is vaccinating older adults. And we ultimately decided to go with the age 65 and up for a couple of reasons. One, it aligned with the federal guidance. It aligned with our guidance from our North Carolina Vaccine Advisory Committee. And if you look at our data, 80% of people who unfortunately die from COVID, 83% of them are over the age of 65. Now, age is not a perfect proxy. It's not for risk, but it's pretty good. Like I said, 83% of deaths over the age of 65 really does help us differentiate risk. So that doesn't mean that there aren't other people with some risk, but age was one that we utilized because it was both easy for folks to understand and it aligned with that federal guidance. Next, we wanted to, again, we're always trying to balance risk from the disease and risk of exposure. Next, we wanted to make sure we were getting other frontline essential workers who can't stay home to do their work, right? Police officers, firefighters, our teachers, our childcare workers. You know, they are going to work every day. They can't stay home. They can't work remotely, and so they have higher risk of exposures. We also know in our frontline essential workers that we actually know that they have more chronic diseases in our frontline essential workers. So there's some increased risk there as well. So we started vaccinating our frontline essential workers this past Wednesday. It's a very big group, like I said, police officers, teachers, clergy, firefighters. But we started this Wednesday with our teachers and our other school personnel, K to 12. So that's our teachers, our bus drivers, our cafeteria staff, as well as our childcare workers. And remember, childcare has been open this entire time. They've been incredible. Childcare has been so important through this, so that parents who were frontline workers, like our healthcare workers, could go to work. The next group after number 3, and then so we started with the teachers and childcare, and then March 10th, we will open up to the next group of frontline essential workers. So, and the group right after that are going to be adults with higher risk of exposure. Now, those are going to be higher risk of exposure or more increased risk of severe illness. So these are going to be adults under age 65 who also work in certain areas that have higher risk, or they are adults under 65 that have underlying medical conditions that put them at higher risk. Again, that aligns with with the federal guidance. And so that will be the next group. And then we hope by the time we're through that group, we will have enough supply that we can get to the 5th group, which is generally everyone else. You can find out more about what group you're in, and I'll share more resources, but we have a tool online that basically allows you to answer questions. What age are you? Where do you work? And it helps sort you into your group, and it takes your name and information, and we will alert you and give you an alert when we are moving to the next group, so you don't have to do much thinking about it. We can text you, we can email you. So there's information you can get from that. All right, next slide. So now we have that prioritization. What I'm really proud of is how quickly and equitably North Carolina has gotten vaccine out. Like I said, we are getting vaccine in from the federal government once a week, and then we get that vaccine out as quickly as we get it. We get out 100% of our vaccines week over week. We actually get it on a Wednesday or a Thursday, and generally by Sunday, we're out. And so Monday, Tuesday, we're waiting for the next shipment. And so we've given nearly 2.2 million total doses. As you know, the 2 vaccines that are out right now are 2-dose regimens. So that means about 1 million people have been fully vaccinated. So that is terrific in North Carolina. So we are working hard. And what I'm really proud about is, again, that equity piece, that we have gotten vaccine to all 100 counties. We have data posted about how many people have gotten vaccinated in each and every county, as well as their race and ethnicity data. And what I'm proud of is the last 3 weeks, we have shown that we are vaccinating our African American population at a good high rate proportional to how they're represented in our state's population. They represent about 21 or 22% of our total state population is African American, and more than 20% of each week over week vaccine has gone to our African American community. So that is great that our vaccine providers are thinking both about speed and about equity, and we need to keep that up. It's a lot of hard work of partnerships with churches, with mobile vans doing vaccinations. It's a lot of work to prioritize people into vaccine appointments. And look, at the end of the day, we know this has been a very frustrating experience for folks because we just don't have enough appointments. We don't have enough vaccines to give everyone who wants it. But I think like I said, we're getting them out quickly. We are certainly vaccinating folks, and we are going to work our way through others. I'm excited that this week, the FDA is looking at a 3rd vaccine. They're reviewing the data for a Johnson & Johnson. It's a 1-shot vaccine, which is really exciting. So it's a one-time vaccine. And that we hope over the weekend is actually going to get its approval from the FDA. And we hope to have that Johnson & Johnson vaccine in North Carolina as soon as next week. So that will be great. Now, supplies, again, going to be limited. It'll be great. We'll have a 3rd. But we know our vaccinating providers can probably do 3 times as many vaccinations than they are doing. So we're not short on vaccinators, we're short on supply. So the federal government, I know, has been working to ramp up that supply as we go here, but we still have work to do to make sure that we are actually getting enough supply to meet the demand. We know we are not doing it right now. I wish we had more vaccine to get to everyone who wants a vaccine right away. We just don't have it yet. All right, next slide. I should also mention that I have not gotten my vaccine yet because it's not my turn yet. I fall into the frontline essential worker category, though I'm not a teacher and I'm not a childcare worker. So neither the governor nor I have had an opportunity to get our vaccine yet. But we both are excited to roll up our sleeves and get the vaccine as soon as it is our turn to do so. So we recognize that the waiting is challenging, and I know it can be frustrating, but we are trying to help everyone get ready, learn about this vaccine, and so that when it is your spot in line, that you take your shot. So there's PSAs from lots of, and a lot of different messages that we are putting out. And what we have seen is that there was a fair amount of hesitancy around vaccine, but that's really decreased a lot as we see more and more people get vaccinated, as people see their friends and colleagues and pastors and healthcare workers and their own community members or family members get vaccinated. They're like, oh, okay, that's for me. Now I see that working. So we see the hesitancy is not gone. We still have work to do always to make sure we're getting out good information, but it's definitely getting better. Okay, next slide. So these are just a few additional resources for you to have and know that they exist. Again, I told you about the Findmygroup.nc.gov, which is where you can put in your information about your age and what do you do, and it'll take your information if you want to give it, and it can let you know when we progress to each group. You can also find, if it is your time to get a vaccine, you can go to myshot.nc.gov. You can put in your zip code and find your vaccine providers. It doesn't link always to an appointment link, but a lot of times we do link through to those providers if they have an online portal. Sometimes they all have wait lists that they're filling up in various ways. And then just main information about this vaccine and answering your questions at yourspot.yourshot.nc.gov. And we have a call center that's Monday to Friday, 7 to 7, Saturday and Sunday as well, that you can call. The number is there, and it can answer a number of questions. Next slide. So I'm just going to end here and then be happy to turn over and answer your questions. Just to summarize sort of where we've been with our COVID response overall, I am incredibly proud of the work North Carolina has done. And it is not something that state government does alone. This is a huge partnership up and down, across and over, with every single partner playing a part here, from the business community to our healthcare system, to local governments and local health departments, the state. It's been just a total team effort that has really shown in the numbers, right? The numbers speak for themselves. North Carolina has avoided the 2 major regional COVID surges that the rest of the Southeast saw. So I don't know if you remember back, but in the summer, there was the Southeast was on fire. Florida in particular was on fire. Their healthcare system got really strained, and we were able to keep a lid on our case rising because we were working together, because we were taking that cautious approach, because we had a mask mandate, and I think that's really important. Now, as we move into vaccine, I'm really proud that we are our top ranked state on vaccine efficiency in terms of administering it quickly, but also equitably. Just last week, we were recognized for having the best race and ethnicity data, as well as transparency in the country. That's something to be very proud of. And that data is important because it's not just to be recognized because you have good data, but it is actually the way we make decisions day to day on how to deploy resources. We've done that all along. I roll out my graphs in front of the press all along to help them understand, and everyone understand, how we're making decisions, because it is really based on our data does drive our decision making. It's whether it's looking at our cases or our hospitalizations or our vaccine rates, that data drives how we do each part of our work. And we have built equity into every aspect of our response. That started back when we were thinking about access to testing. And we saw that there were certain communities that have had less access to testing, we stood up a state-funded and state-executed testing effort that went into communities that were underserved to make sure that we were testing those who are Hispanic, testing those that were American Indian, and making sure that we were getting into every community, African American and others, across North Carolina with testing. Now we're doing the same thing with vaccine. So I'm pretty proud of that work. But I will say it's been a hard year. I know for everybody. I want to thank everyone for what you've been doing. Everyone's played a role in this, but from the state perspective, we've had to do a lot to build our response effort. And there's a lot of lessons learned in that. We didn't have the ability to plan for hospital surge or even collect the data on hospitalizations when we started. We had no visibility into what was happening in our hospitals in terms of who was there. Were they there with COVID? How many ventilators did we have? All of that we needed to do. We didn't have a supply of PPE with masks and gowns and gloves that, we really ramped that up as well. We had 0 tests when we started this and anywhere. And we really worked to ramp up a testing infrastructure, but also a data reporting infrastructure that allowed us to collect that information. And all of this we have to explain things as we go. And we're really asking everyone to change behavior, which we know is so hard, right? To move through the world differently with a mask on. That is a very different state of being for everyone. And that takes a lot of communication. Why are we doing this? What is the data? What is your reason? And what can you tap into to make behavior change possible? So it was a ton of communications efforts. But one of the things I'm also really grateful for in terms of our overall work was recognizing that health and responding to this health crisis was not just about access to a test or access to a hospital bed or access to a vaccine. Now, that's always going to be important, and it is. But it is also thinking about health broadly. We know that when we needed to think about health beyond the walls of a hospital, beyond just a test. And we needed to think about someone's food security, their transportation to or from work or to their doctor's appointments. That's an issue. Housing is a huge issue, particularly when you're asking someone to isolate or quarantine and stay away from folks if they have COVID. Gosh, housing became such a critical piece. And so we've stood up a number of programs to help folks have housing security during this time, and basically to give folks money to sustain them while they were able to isolate or quarantine because they had COVID, right? When folks only get paid when you work, that is a huge, huge impact for being exposed to COVID, let alone having COVID. So we stood up a wraparound support program where we offered folks wage replacement if they had to isolate or quarantine because of COVID. And it was really, really important and successful. And I'm really excited to see that the data has shown that we definitely slowed the spread of the virus because of it. Exciting stuff. So we definitely had to think about health broadly. We had to build a network of data to drive our decision making, and we had to embed equity into everything that we have done. So it's been a lot of work, a lot of important lessons learned here. I think a lot that can apply for the future. I know one issue very dear to the League of Women Voters, and I'm grateful for this, is that you've always advocated for expanding access to insurance coverage. Health insurance coverage is critical for someone to be able to access the things that I'm talking about, from testing to vaccines to primary care, to make sure that they're taking care of their underlying chronic conditions. And as you know, North Carolina went into this crisis with one hand tied behind our back. We had more uninsured here than most other states because we have not expanded Medicaid. And that puts our state in a weakened position. Now, I think we've done very well despite that weakened position, but there is no time like the present to expanding Medicaid, where we're trying to still respond to this crisis. We've had an economic hit because of this crisis. We need Medicaid expansion, and we need it right now. And the thing is, we can say just one word, yes, and we would have Medicaid expansion. We'd have 500,000 people in North Carolina with an insurance card. So that is something you're going to continue to hear me advocate for, the governor advocate for. And so that continues to be a top priority for us as we as we move forward in our recovery and response efforts to COVID. All right, with that, I'm going to stop and take any questions you might have. And thank you again for the time.
Hi. Hello. So I am Diane Payun. I am the second co-chair of the Timely Topics. So thank you so much, Dr. Cohen. We have a few questions that have come in. I'd like to start with a few of the basic questions. And I'm also going to bring in Retta Riordan again because she is the chair of the Healthcare Committee and she'll have some more expansive questions for you.
Sure.
So what we've had come in has to do with the vaccine and getting vaccinated. We have people asking about the antibody levels. Are you going to monitor them? And then let's talk about safety in indoor gatherings with small crowds. Say once you're fully vaccinated and you have family members who are vaccinated, is it safe? Do you need to wear masks?
Okay, so let me tease some of those apart. So first is, how are we going to monitor whether or not the vaccine is working? I think was essentially the first question. And are we going to be looking at antibody levels and such? So right now, there is not a recommendation to be monitoring antibody levels. That may be something that is in the future when we think about, how long will immunity last from this first vaccination effort? And so we will have to be tuning into the scientists who are sort of trying to answer that question right now. But right now, there is no need to get an antibody test to make sure the vaccine took or is working. What we have seen is that these vaccines are safe. They are effective at preventing COVID, and importantly, they are incredibly effective at preventing severe disease from COVID, meaning getting severely sick that you would need hospitalization, and they had no deaths for anyone who was vaccinated, which is terrific, which is a lot of protection we want to see. But I think the second question about, well, what can I do once I get vaccinated, right? That's a question my mom is asking me, right? Because luckily my parents just got their second vaccine. They're in New York, and they just got their second vaccine, and she's like, well, what can I do now? And it's a great question. So what I would say is, you are not fully vaccinated until you get your second dose, right? So just like, let's be sure, if you are getting a Moderna or a Pfizer, if you're getting the 2 dose, you have to get both doses, and you need at least 10 days after your second dose. So let's just assume you're past that. Then the issue is that I think you are personally protected, which is good. So that means you can be doing more things in the world. However, the thing that we don't know the answer to yet is, could you still get COVID? Now, you won't get sick because we think that the vaccine is protecting you, but could you get it and still give it to someone else and not have any symptoms, but give it to someone else? And that's where we are saying we don't know the answer to that yet. Scientists are working on that answer and trying to understand it right now. So our recommendation is, even if you've been vaccinated, if you are around other people who are not vaccinated and you're going out to a restaurant, you should be wearing a mask and be masked. So, when I talk to my mom, I haven't seen my mom in person in over a year, which is the longest I've ever gone in my whole life of not seeing my mom and my dad. But I was saying, when you come here, right, I'm not vaccinated. My husband's not vaccinated. So if they come and visit, they will wear a mask when they are here, but they are protected, which is so good, because before I was worried I am a risk to them. Now I'm not a risk to them. Now there may be a little risk to me, right? Because they are vaccinated, and it is possible that they could be carrying COVID, that they're going to go through an airport, right? And all the things, they could carry COVID, not know it, give it to me. So that is the risk. So what I would say, once you're vaccinated, yes, you are protected, but is it possible for you to have COVID, not know it, give it to someone else? Yes, it is possible, which is why we say you want to continue to be masked during this period of time. Now, I think we will learn more to know, how long do we need to do that? How much of a risk is it? I think those are things we're still learning.
Retta, would you like to?
Sure. Thank you, Dr. Cohen. I thank you and the department for the state for having learned this baffling and very serious virus so quickly and prioritizing the most vulnerable of those of us in the state and getting the vaccines into the arms of those people who need it most as quickly as possible. And I know the frustration is the supply and not the vaccinators, but I know you're working really hard on it and we feel really good about it. We have gotten many questions that fall into the buckets, and you've covered some of it, but the basic buckets are when, and when will we have the vaccines, enough vaccine, and when will we be safe? And I think you've pretty much addressed the second question. That's probably 20 of the questions that have come in. When will we be safe?
Right.
When will we individually be safe? And when will we be safe to be able to participate in other activities? And what is our risk after we get vaccinated? And what is the risk both to ourselves and to others? I think that's what you were just addressing right there.
Mhm.
A lot of questions about when will we be able to return to life as perhaps normal. Normal, yeah. Getting around in larger groups than we've been getting in. When will it be safe? Do we all have to be carrying around our vaccine cards saying that, yes, we are fully vaccinated? And I think that's probably 80% of the questions that have come in so far have been hitting on. So I think you've touched a lot of it, but.
Yeah, let me touch a little bit more because I know this is frustrating, but some of the reason why it's hard to answer those questions is there's some things I know and things I don't know. We know once you get the vaccine right now, what your level of protection is. The issue is, as I was mentioning before, this virus is changing. And the question is, how fast is it changing and how fast is that change spreading around? So how much of that variant of these new versions of COVID are in North Carolina or in any parts of the country and the world? And what does that mean for our level of vaccine protection? That's the wild card and the unknown here that makes it hard for me to answer those questions. And I know that feels frustrating to folks. It's frustrating to me, right? Because we all want certainty. And after this whole frustrating year of no certainty, what I would say is we're moving in the right direction, right? Getting the vaccine, I feel good about it, but there's these unknowns. One part of the unknown is how quickly can we get the supply of current vaccine into arms, right? And there's only so much we're only getting about 200,000 doses a week. You do the math, we have 10 million people, right? That's a lot of weeks we need to, but every week we seem to get more and more and more. Now we're about to get a third vaccine. All of these things help and we get further along. So I do think by the summer, by June, July, that vaccine is going to be widely available to those who want it. So we're going to be open to group 5. Now, it doesn't mean everyone's going to get it in June, but I think over June, July, the summer, that, I think folks who I apologize, it's my phone, that folks who want to get a vaccine will be able to get it over the summer. So that tells me, I think by the summer, by the beginning of the fall, that we will all have some amount of protection and the normalness will feel different. I think by then we'll also know more about how much of a risk, if I am vaccinated, how much of a risk am I to someone else? I think we'll have more information about that as well. And I think all these things together we will learn and we'll get better. So, but I think this will turn into a seasonal issue, right? Like flu is, and that we will see an uptick in cases in the fall. The question is, in what population is this a changed virus? Are we going to need a booster? Are we going to need a booster vaccine every year? Are we going to need it every 2 years? Or are we not going to need it at all? Those are the unknowns that make it hard to answer that question. So what I would say is we're heading in the right direction. Definitely want to get your vaccines. That we already know that that's going to offer protection for folks, safe, effective. I want to say that any of the vaccines that are coming out, the Johnson & Johnson vaccine, remember, highly effective vaccine, highly effective at preventing severe disease. Remember, these vaccines were tested at different moments in time. Remember, the Pfizer and Moderna were tested before these new variants were out in the world. The Johnson & Johnson is actually tested when these variants are out in the world. So, you know, there are advantages to that as well. So even as we hear numbers of, oh, is this a lower effectiveness or not? I actually think that's more of a time series of like when things were tested, and we need to incorporate that. So I think we're going to have 3 vaccines that are safe, that are effective, that prevent severe disease. So like I said, I think moving in the right direction. My crystal ball is still pretty fuzzy on where we're going to be, but we're heading in the right direction. I think the summer is going to feel different to folks, but we are still going to need to be careful, and that's okay. Being careful and being home are 2 different things. So
we have a couple of questions that people have been asking about basically the timeline, and one is when you start getting down into the next categories, are you going to open it up to people under 65, or is it going to be everybody rushing in at the same time? Or are you going to be doing it decade by decade slowly? Because those people in the 40s to 50s are sort of thinking that they don't want to be competing with the people in their 20s. And the second category, which is sort of along those lines, what are we doing to get the vaccines into the underserved communities? So if you can address both of those, that would be great. Thank you.
Sure. So one of the reasons why we've had to do prioritization is because the supply isn't good. So we will continue to sort of need to chunk things out to manage manage the demand, right? Manage the number of people who are eligible for a vaccine at any one time. So just the way it'll progress. Right now, we're doing frontline essential workers, and we've only opened to a subset of those, right? We've opened to teachers and childcare. Next, we'll do rest of frontline essential. Then we get to a pretty big group of people who have chronic diseases and have higher risk of exposure because of their job. We will, depending on supply, I think is really going to drive our decision making on, do we open to everyone, or do we try to move in a couple of phases within that group like we're doing now. Right now, our supply is very limited. As we move forward in time, the supply gets better and better as we go on. So I'm hopeful that we won't have to limit it, and it'll just be that there'll be more places to get vaccine, more appointments, and it will be more available. So I think, again, one of those, you're going to stick with us. We'll see. Assuming that there isn't a supply crunch, then we don't have to limit it. But if there is a supply crunch, we may use things that help us sort of gate things out so we don't get a big rush, and it helps us manage a little bit better. But I think we're going to have to play it by ear a little bit based on the supply. And then the underserved communities. So this is something I'm super proud of, and I think North Carolina is leading the nation in terms of our ability to get vaccine into underserved communities. So one is we just allocate and we give more vaccine to counties that are serving higher proportion of African American or Latinx or American Indian. So we just give more vaccine to those communities. That's the start. Second is we hold folks accountable. We say you got to be vaccinating proportional to the population you're serving. So if you serve 30% African American, we expect your vaccines to be 30% African American. And we have data, and we're very, we have a lot of transparency around it, and we hold folks accountable. And what we see is actually folks are really rising to that challenge. And then the third is we also use our vaccine allocation to target special events to underserved. So, for example, we know we're not doing as well as we should in our Hispanic community. And so this week there's been a big focus on making sure we're having events that focus on those communities exclusively. So we try to use a bit of our allocation to make sure we're doing it. And you have to use a variety of strategies. There are a lot of partnerships with the faith community. The faith community has been amazing. They've hosted events right at their churches. They've been generating the list of people and making the appointments for them, and like partnering to make sure that we get underserved folks into appointments. There's lots of different techniques that folks are using. And it's been really gratifying to see that everyone's stepping up to make sure that we are serving all of North Carolina.
Great, thank you so much. I have a couple of non-COVID related questions, and one tags on to one of the last things you said in your prepared remarks, and that was dealing with Medicaid expansion. You know, it's been a travesty here in North Carolina, and we all recognize that, that we've been one of the few states that did not expand Medicaid, especially during this pandemic. And depending upon the numbers, it looks like at least 700,000 people could be covered if we had expanded Medicaid, especially during the pandemic. Now, what do you see any possibility that the legislature is going to move on this? And is there what can we within the league do to assist you in this effort? I know it's one of your priorities, but it hasn't happened.
Yeah, so the thing that I would share that I think it can be a game changer is related to what's happening at the federal level. So there is another COVID package that is moving at the federal level and is getting debated. It already was voted on by the House. It's now over at the Senate. And in that bill, it offers even more money to those states who have not expanded Medicaid to say, if you expand Medicaid, we actually are going to give you more federal dollars to do that expansion. So normally we would have had to pay about 10% of some state dollars. And again, we were going to raise that money without having to use any state dollars to do it. But now in the federal package, they're going to give us actually more money to match with our state dollars to pay for expansion. That's a very different place. So not only are they saying here's 90% of the money, they're basically saying here's 120% of the money for a few years. Will you expand Medicaid? And I think that is an offer we hope will spark a different kind of conversation at the General Assembly.
Excellent, thank you. And then a quick question on, I know opioid addiction is one of the issues that you've also been working on. I know you've been putting a lot of efforts into bringing the opioid death rate down. How has the pandemic increased these deaths, and have you seen your efforts bear fruit?
So, I would say pre-pandemic, we were really heading in a good trajectory. Things were improving. We saw the lowest number of opioid overdose deaths that we had in years. And I was really proud of where we were. But the pandemic definitely threw off that progress. And it's not surprising. We've seen increases in mental health issues, depression, anxiety, and addiction issues throughout this pandemic. And so unfortunately, we have gone and did a bit of a backslide in terms of our progress. But I just met with our team this week about making sure we were reinvigorating this program. I will say we have a syringe exchange program here in North Carolina, and it has not done the backslide, which I'm really happy about. So the work that they have done, they have been able to continue to do despite the pandemic. So that is a bright spot. But in terms of overall levels of addiction, and we're still, we have more work to do. We are very much utilizing these settlements. I don't know if you've heard in the national news that there are these opioid settlements, because look, there was some folks marketed this in a way that was, obviously the judges are finding that it was incredibly inappropriate and criminal. And so they are settling and paying out money to states and localities to really try to tackle the opioid crisis. So we're working hard to make sure that money gets put to good use. We know we know the menu of things we should really be focusing on that really make a difference. I think our job is now to make sure that we get the cohesion of work with those dollars to really move the needle and make the impact that those dollars can bring to our state.
Excellent. We're all aware of gross inequality in healthcare, particularly as it relates to whites versus non-whites and urban versus rural. What's the department doing to reduce these inequities? And is there anything that we as the league can do to help in that area?
What a great topic, and so important. So there's for me, I will say, as I think about, right, I've been the secretary for 4 years. One of those was a pandemic, so that was a lot. Felt like 4 years in one, so maybe it feels like 8 years already. But as I think about that Governor Cooper winning re-election, and in the next 4 years, I have really worked with our team to rededicate ourselves to equity in our work as we move forward. And there's so many aspects to this, whether it's in infant mortality, in basically every health statistic we capture, there is a disparity, and we're getting better at capturing the data. What we haven't done is now change the way in which we work, deliver, use our time, our money, and our resources to actually move the needle for change. And so we have been talking about, as a team, about how do we systematically do that across the board in everything. So you're going to see that as a theme. And I think the way we've approached COVID is the way I want to approach all of the work across my department. It's cross-functional. It's recognizing that health is very broad, but it has an equity lens, and it starts with data, right? You can't improve what you don't measure. And so it really does start with that measurement, and then build resources, time, and talent to make sure we're addressing those issues. It's a big topic that I could probably come back and talk about, but that's like the short nugget of highest priority, such an important priority of the governor. He had the Andrea Harris task force, which sort of laid out some very bold goals that we intend to make sure that we are implementing across all things. But stay tuned for a lot more. And I hope to use our COVID framework for how we've done this with advisory committees, and making sure that we're hearing from the community and working closely and building bridges with the community is how we will do our work going forward.
Great. And I know this is another one that would take an entire seminar on it alone, but can you talk a little bit about Medicaid managed care and the decision that came down last week, upholding your decision to award the contracts to the insurance companies?
Sure. Wow. Now we're getting into the details here. So yeah, so we do have a big change in our Medicaid program coming up. And that is something that's been in the works for many years. And frankly, before I got here, this is the General Assembly had moved the Medicaid program to managed care, meaning to private insurance companies. And that is set to roll out for the first time in July of this year. And now there's been a lot of hiccups along the road, including that the insurance companies who didn't win the opportunity to participate in the program, doesn't ever feel good to lose. And so they took that to court, but we won in court twice now. So I think that's been put to bed, that we have a solid procurement, meaning a relationship with the health insurance companies. And so we are now moving forward. Starting March the 15th, our Medicaid beneficiaries will be in what's called the open enrollment period. I mean, they'll have the opportunity to choose a private insurance company that they will then be a member of, that will administer the Medicaid program on behalf of the state. So that's going to start March 15th, which is just around the corner. So you'll start to hear potentially more, see some ads about that starting in the middle of March. And then July 1st, the biggest change is how we pay doctors and hospitals. Instead of them getting paid directly by the state, they're going to get paid by the insurance companies. And so there's just a lot of technology and processes that we have to make sure are working. And it's been a hard year. Everyone's been real busy. So adding this on top of a really busy year, we recognize is really hard. So we're trying to do a bunch of things to make sure this goes as smoothly as possible. But change is hard no matter when you do it. And now we're doing it on the tail end of a hard year. So, we're trying to be really sensitive to that.
And now getting back to COVID, there were a lot of questions involving long-term care facilities. Obviously, the more vulnerable of our population are in long-term care facilities. There were questions along the lines of, when will it be safe to visit our loved ones? As you say, you haven't seen your family. What percentage of staff need to be vaccinated to make it safe? Should this be mandated that people working with long-term care facilities be vaccinated? Is there a different answer for the different levels of care within the spectrum of long-term care, assisted living, and so forth? Is it, if we all get vaccinated, will it be safe for us to get together to see our loved ones? And I guess sort of not related to long-term care, but somebody did ask about herd immunity, and if you can address that too.
Oh boy, okay. So the short answer on long-term care is that, hold on one second, I'm sorry. It's my boss wanting to know why I'm not on this call. So I have to go in a second. Sorry, okay, he's all right. So I do have to go in a second, but so on long-term care, the short version is that we want to make some changes to visitation policy, particularly now that we're finally kind of over the hump of that second vaccine getting done. Nursing home visitation is really guided by the federal government, by the Centers for Medicare and Medicaid Services. So we are bound by a lot of their rules, but we have heard they're in the process of updating their rules. When we think about other settings like adult care homes, assisted living, that's more in our space. And so our team is right now looking at that and seeing how we can loosen restrictions. As far as mandating the vaccine, I think this is a hot topic. I'm not the lawyer, but the thinking is mandating when something is in the emergency use authorization sort of phase of things, which is how we've gotten the vaccine out as quickly as we can, that we don't believe that mandating is possible, but that may be something that happens in the future, right? There are many places that mandate the flu vaccine, for example. So that may be something we will see going into the future. And on the herd immunity, just as the last point, it's a hard concept to pin down because of the wild cards I keep talking about. It's immunity to what, right? Because if COVID keeps changing, are you at herd immunity, or are things not really there, right? So again, I think it's going to be this up and down thing where we will have to understand how much immunity we get from the vaccines, how much immunity do you get from just having COVID, how fast are these viruses changing, are we going to need a booster? All of these things sort of play into the herd immunity question. Certainly the more people vaccinated, the better, right? Let's just be like, so that's my goal. Let's just get as many people who take vaccines, and I hope it's every single person in North Carolina will do that, because these are safe, they're effective, they protect you, and it's going to help not just you, but everybody by getting vaccinated. So that's my parting thought. I hope everyone gets vaccinated.
But
don't forget to do the 3 W's.
I just want to share with you a couple of comments before you run off, because the governor needs you. I just want to quote a couple comments that were in the Q&A. Thanks for all you're doing. Fantastic job, all in capital letters, and North Carolina is the best. So we all thank you so much for what you've been doing to keep us safe.
Thank you so much, and thanks for having me. Thanks for all the work you do to advocate for those who often don't have the voice to do that. So thank you for doing that. And I hope this was helpful at answering so many good questions. Wow, this was one of the best sessions of questions I've gotten in a really long time. So thank you, really thoughtful.
Thank you, Diane.
Yes, this is Diane again. Thank you, Dr. Cohen. We'll let you jump off, and thank you for your time. And for all your participants, this webinar was recorded and will be posted on the LWV Facebook page in a few days. Please log in and listen to it again, and tell your friends. And don't miss our next timely topic presentation. It's March 18th, and we'll give you an opportunity to sharpen your fact-checking skills and be prepared to spot biased news coverage. Tune in for that. And finally, a big thank you again to the Healthcare Committee and Retta Reardon for helping us this evening. Find out how you can help out on the committee by going to LWV-Wake.org. You can find out about all of our committees on our website. Again, good night, and thank you so much.